Hi, everyone. Welcome back to the Breast Cancer Podcast. Hello, I'm your host, Dr. Deepa Halaharvi, a fellowship trained breast surgeon, and also happen to be a breast cancer survivor, thriver, and a warrior, living my best life. As you know, breast cancer affects millions worldwide, touching lives in a profound ways. Whether you're someone facing a diagnosis or a supporter seeking information or just eager to learn more, this podcast aims to be a beacon of understanding, hope, and empowerment. I'm here to talk about all things breast cancer, from surgery to survivorship, as well as high risk for breast cancer to metastatic breast cancer. My goal is to provide you with reliable information, share inspiring narratives, and foster a supportive community. I know firsthand the challenges breast cancer diagnosis brings. Throughout this podcast, I will give you strategies to handle difficulties that arise from cancer diagnosis. We'll have insightful conversations with medical experts, researchers, survivors, caregivers, and advocates. I will tackle topics that impact our lives as cancer survivors. My goal is to educate you and empower you to live your best life. I definitely have. Well, let's get started. Hello, everyone. Welcome back to the Breast Cancer Podcast. My name is Dr. Deepa Halaharvi. Today, we are looking beyond breast and zooming out across the globe. We are diving into the newly released Cancer Atlas, a powerful visual map where cancer strikes hardest and why. I am so excited to have Dr. Kelli Rath join me today. She's an amazing oncologist here in Columbus, Ohio. And together we're going to explore global landscape of women's cancers, from cervical to ovarian to endometrial. We'll talk about disparities. We'll talk about prevention. We'll talk about HPV and geography. Still too often predicts survival.
Yeah.
Welcome, Dr. Rath. Thank you so much for
much.
taking the time to be here today.
Thank you for having me. It's such an honor. It's such an important topic.
Yes.
And so excited to share information with people so that they can protect themselves and others and really spread the word
Yes.
about cancer prevention.
Yes. Thank you. So whether you're a provider,
Mhm.
a patient, a policymaker, or a survivor, this episode is for you. So we'll kick it off by asking, what is Cancer Atlas anyway?
Right. So the Cancer Atlas is brought to us kind of by the American Cancer Society. And this is the 4th edition. So they've been doing it for a while. And it really gives us information about where cancer is happening, why is cancer happening, how is it similar and different in various countries.
Yeah.
It maps out the burden, the trends. It looks at geography, income, exposures. And so super amazing information just to help us understand kind of where are we in the United States, where are we globally, where are we in whatever country you live in. We know that cancer has been increasing as the population ages. Cancer is something that happens as we age, so that's naturally going to increase.
Right.
But we know about 16 million cancer cases, 10 million deaths a year today. That is projected to increase to 33 million by 2050.
Yeah.
And so continuing education and prevention and getting the word out to people is so important.
Yeah.
And one of the things that this teaches us and talks about in this atlas is 50% of these cancer cases are going to be caused by modifiable risk factors.
Yeah. Isn't that crazy?
Yes. So that means,
Yeah.
There's so many things that we can do. And we're not talking about changes like you can't ever eat sugar again, or you have to work out and run an ultra marathon.
Right.
These are like small things that we can all do in our everyday lives,
Yeah.
no matter where we are.
Yeah.
Things like tobacco use, alcohol consumption, getting a small amount of cardiovascular exercise, focusing on a healthy diet, avoiding ultra processed foods, all of these things that are important. And then the other thing that it teaches us reviewing this data is that social determinants of health are incredibly important.
Yeah.
Lots of people don't have access to, number one, these preventative things,
Right.
a healthy diet, but also may not have access to screening as well as treatment for these cancers.
Right. And I think that's really so important. And so this is all evidence-based.
Right.
And we're talking about global health and global cancer. Therefore, there's map behind us here, looking at the global picture. And I have always thought of myself as a global citizen, being born in India, was raised in Libya, and was brought up here in America when I was a teenager. And so I think of ourselves as global people. What can we do locally? What can we do nationally? But then also, what can we do internationally and globally? So, Dr. Rath, I know you have said nearly half of these deaths are related to preventable factors. Can you speak of that in context of gynecological cancers?
Right. So gynecological cancers, I think we think about two big things. The first one is cervical cancer. So cervical cancer is related to HPV infection in almost all cases. And HPV is a virus, and we have a vaccine against the HPV virus. We also have secondary prevention, which is screening for cervical cancer. And so really, if we pulled all of our resources nationally, internationally, cervical cancer should be a never cancer. We know that other cancers are associated with HPV infection, head and neck cancers, vaginal cancers, anal cancers, penile cancers, many other cancers, but cervical cancer being one of the biggest burden for women, not in the United States, but internationally, globally, it's one of the most common causes of cancer death. And it really should be preventable.
And I think that's the most important point to take home is, there's HPV vaccinations. I've had my kids get the vaccinations. We recommend others.
My kids got their first dose last summer. They turned 9. It's 9 now instead of 11.
Is that right? So let's talk about the ages now.
So it used to be, I feel like it started 2006. It was like older kids, and then it was age 11. And so most recently, age 9 seems to be like the right age to start the vaccine. As long as kids are starting before 15, they only need 2 shots. And you can do them a year apart. So you can do them really easily at your kids' check-in. But by age 9, some of the data that more recently is coming out that just one vaccine may protect a lot of kids, especially if you're starting younger. And that'll be important globally, right? When we only have so many resources to give. If we can do one vaccine instead of 2 or 3 vaccines, that's going to just be so important. But age 9, and the earlier kids get the vaccine, the better it seems to work. So if they're getting it at 9 before they have any exposure, their risk of cervical precancers or cancers are exceedingly low compared to somebody that may get it in their later teens or 20s.
No, as an adult, can we get HPV?
You can. So the HPV in the US, it's I think FDA approved up to age 45. So you can get it when you're older. But after you've been exposed, it's not treating the virus you've been exposed to, but it would protect you from any additional exposure. So if you're exposed to a new HPV virus, it would help prevent against that, but it's not going to treat the
already exposed HPV. That makes sense. That makes sense. Wow, that's really good to know. And what are the most concerning modifiable risk factors for women today? And men?
And men. So I think tobacco is the number one. I was shocked when I was reading the atlas, how many people are using tobacco, 25% in the United States, up to 45% in China. And so this is the number one preventable cause of cancer death.
I was shocked to see nearly 2 billion people across the globe smoke. I was like, wow, that's a lot of money. We are spending a lot of money in something that's really not providing us any benefit. It's potentially, providing us with harm.
And then I think another one is alcohol. I was surprised at how obviously alcohol use is increasing kind of across the globe. The amount of alcohol consumed per person is quite a bit. And we know for men, it seemed like the biggest risks were with moderate or heavy use. But when we look at women, even light use of alcohol seems to significantly increase the risk of cancers. And so really getting that information out to people, I think is important.
Breast cancer world, we say less than 2 drinks per week. There's, if you want to have social, it's okay, but not a lot of alcohol use is what we say. So alcohol and tobacco, those are things that we can control, and that's in our control. And from your perspective as a GYN oncologist, what do we need to do more of globally and locally to address this rising burden of cancer?
So I think globally, HPV is huge for women, right? We know cervical cancer is huge. I think that when we think about kind of one thing we didn't talk about was diet. We know obesity is linked to many cancers. Up to half of uterine cancers are related to obesity or metabolic syndrome, diabetes, high blood pressure, all of those things working together. And we're seeing increasing rates in these lower middle income countries as we see more people start to struggle with those diseases.
Yeah.
And so really putting resources in around healthy diet, making sure that people aren't in food deserts, whether that be, in Appalachia or, urban areas or in other countries. So those, I think, are big things that we can think about.
Absolutely. Absolutely. And we need investment in prevention, HPV prevention and screening programs and health education like this. And we also need cancer registries, trained healthcare professionals who can talk about this with our patient populations and go out in the community and give talks. And this podcast, for that reason, it's in over 135 countries. And I feel really proud that we can provide this information not only locally, nationally, but also globally. And it's about partnerships, not just with our healthcare providers, but with our government people. We need to all work together. And as a survivor, I've seen this firsthand. I hear and read these statistics. I'm one of those 1 in 8 women who was diagnosed with breast cancer. So it becomes very personal when we talk about prevention, things that we can do. Screening for breast cancer screening. If you don't have family history, if your average risk person started at age 40, if you have family history starting 10 years younger than your family member who's diagnosed, if you're considered high risk for breast cancer, you fall into a different category of screening with mammograms alternating with breast MRIs, as well as monthly breast exams, every 6 months clinician exam. And there's medications that you can also take if you have a genetic mutation to decrease the risk of developing breast cancer. And what would be your final message to our viewers today?
Yeah, I think my final message is there are a lot of things that you can do to prevent cancer, right? We can work on, number one, not smoking, encouraging, and secondhand smoke is a problem also, right? So it's not just you. It's, if the kids are exposed, if spouses or whoever lives in the house is exposed to that secondhand is really important. Focusing on physical activity. I was reading a statistic that only I don't know, I can't remember, but it was a shocking number of adolescents are not moving or not getting the physical activity that they need.
Too much screen time.
Too much screen time, not enough outside. So really getting exercise, getting out there, moving, focusing on what can we do to get people a healthy diet, and talking about these things, making sure that people understand that these are small things that they can do that can make a huge impact. And then obviously making sure you're getting screened, right? Making sure your kids are getting HPV or your nieces or your nephews or whoever it might be is getting the vaccine, and then making sure people are getting in for their screening exams to make sure that we're checking for PAP tests, HPV tests, all of those things.
Breast cancer screening,
colorectal.
Yes,
so important. Colorectal cancer is on the rise among young people. Getting your colonoscopy, if you're in a place that you can access the Cologuard, that's a non-invasive screening test that's really getting a lot more people screened. My husband just did his. He didn't want to get a colonoscopy. He turned 45 this summer. He got his test. It was negative.
So, that's awesome. Good job.
Yes. Important to get those things done. So those that might not want to get that colonoscopy. And it's another thing. We talked about resources. This test decreases the number of colonoscopies that need to be done and gets more people screened. And so when we're talking about resources and low resource areas, it's really important.
That's awesome. That's very true. So again, I'll just summarize for the healthcare professionals. It's important for us to go out and educate our patients on prevention, on support policies that advance access for individuals. Take health into your hands and ask your providers what are different screening guidelines that would be applicable to you. And we need to talk to each other about family history. Talk to your family members. I know I come from, I was born in India. Indian families don't talk about family history of cancer. My mom, for one, said, oh my gosh, you're going to go on TV and tell people that you have cancer. I'm like, Mom, it's not like I didn't steal or anything. It's cancer that happened. It gives me an opportunity to help others. And that's really why I use this platform, is to help others get educated so they can empower themselves. And make sure you're advocating for your health. End of the day, as women too, we make so many decisions for our family, healthcare decisions. You just talked about your husband. I took care of both of my parents. We make a lot of decisions for our kids, for our spouses, for our parents. It's important to be on top of screening guidelines, telling your men to get their PSAs if that's something that they need to get, colonoscopies, skin checks, make sure they're not being exposed to UV light, because that's one of the modifiable risk factor for cancer, for skin cancer. And, not smoking, limiting alcohol use, getting your yearly screenings with your physicians. And for if any system healthcare leaders or system leaders nationally or locally listening to this, please commit to equity-focused care, cancer care, not just locally, nationally, globally, because that's really important to reduce this burden of cancer amongst people.
Yeah, I agree.
Anything else you want to add?
No, I think you got it all. And I just think really talking to our leaders, our elected leaders also, understanding that this isn't political.
Yeah.
This is about healthcare. This is about the data. We know that this is a problem. And if we can put things in place to protect people and get people what they need, it's so important.
Yeah, that's awesome. Yep. So Cancer Atlas, it gave us data, but what we do with it is up to us.
Yeah.
And we need action rooted in equity, fueled with prevention, and driven by compassion. Thank you so much, Dr. Rath, for being here, for taking the time in your busy day today. You're rounding, you're taking care of patients, you're doing things for your family, and you made the time to be here. And I really appreciate your time. And what you shared is really very powerful. And don't forget to follow the Breast Cancer Podcast, give it good rating and share it if you found this podcast to be useful. And as always, stay informed and educate yourself so you can empower yourself and keep shining. Until later, bye-bye.
Thank you.
Thank you, everyone, for tuning into the Breast Cancer Podcast. Remember, you're not alone in this fight. I encourage you to be an active part of this podcast. Please share your stories, questions, and suggestions for future topics at my website called drdeepahalaharvi.com. And please share this podcast with others, especially if you found it useful. And please also give it a 5-star rating, if you will. Stay connected as we navigate the complexities of breast cancer. Until next time, take care and keep shining brightly. Disclaimer, this podcast is not intended for complete medical advice, so please talk to your medical professionals.